Hello, and welcome to Understanding Food Selectivity. This is a pre-recorded workshop developed by Kids Inclusive staff. This video is part of a 3-video series to help families to identify challenges and learn new strategies to support food selectivity in their child's lives. My name is Lisette, and I'm an occupational therapist at Kids Inclusive. Let's get talking about food selectivity. Before we get started, this presentation is not targeted towards one specific population or diagnosis. In order to provide the most universal approach to care, we aim to provide a variety of strategies and considerations. Please know that not every strategy is going to be appropriate or work for every family dependent on your child's needs, but we do hope that you can find something that you can take home today. We also want to acknowledge that at Kids Inclusive, the use of language is evolving rapidly and will continue to be an ongoing discussion with the neurodiverse community. During this presentation, we will be using both identity-first language, such as autistic person, as well as person-first language, for example, person with autism or ADHD. In this video, we will target our first learning objective and talk about reasons your child may experience food selectivity. Just a reminder before we jump in that change does take time. The strategies and information presented today are not expected to provide immediate results or solutions, but we do hope that it can provide some building ideas into your daily routine over time and help your child reach their goals. So part 1, overview of feeding and food selectivity. From feeling hungry to eliminating digested food, there are many steps that happen in feeding that many of us don't have to think about. For example, biting, chewing, moving the food around with your tongue, swallowing, digesting, and eliminating, just to name a few. For children who are still learning, struggling with any step along the way, or lacking certain skills involved with feeding, it can create a really big hurdle in our day-to-day feeding routine. When talking about selective eating, there are a number of considerations we want to remember when we choose our approach. I will briefly go over each consideration in the coming slides. So the first and biggest consideration are the medical considerations listed here. These considerations related to feeding are beyond the scope of this workshop. However, to ensure that you are seeking the right supports for your child, it is important to review them. If your child is experiencing any of the above health or medical conditions, please seek assistance from a physician, and it is not recommended to proceed with implementing strategies outlined in this workshop until you have done so. I'd like to highlight one point in this list, which is often overlooked, especially with a lot of the clients that we work with, and that's constipation. A lot of our kiddos do struggle with constipation, and this can have a huge effect on their appetite, create feelings of nausea, and trying to build on feeding skills when they're struggling with constipation can be really unenjoyable and can really impact the success or progress that our children make with feeding. So just another disclaimer that the safety risks and medical considerations stated in the previous slide are beyond the scope of this workshop. The information in this presentation is provided for informational purposes and strategies about selective eating. It is not suitable for professional medical advice, diagnosis, or treatment. And again, if you do think your child is having trouble with swallowing or any of the medical concerns stated in the previous slide, please consult with your physician or other qualified healthcare professional before implementing the strategies we discussed today. So now let's talk about selective eating. What is it? You may have also heard of other titles such as challenged eater, picky eater, or extreme picky eater when you hear about selective eating. For the purpose of this presentation today, we are using the term selective eating as we feel it best reflects the fact that the reason for selectivity is out of our child's control. And just a quick note about ARFID, which is also known as Avoidant Restrictive Food Intake Disorder. If you have a child who has been diagnosed with ARFID or has less than 10 foods in their diet, or there are ongoing significant concerns about their nutritional intake, we unfortunately do not recommend this workshop and would recommend seeking a more tailored approach to your child's feeding with medical supervision. So more specifically about selective eating, it may refer to refusal of whole food groups, show reluctance with trying or introduction of new foods, and may be consistent with having a smaller food range. Just a side note, though, it is common for many children to hit a developmental stage where they do become a little bit more selective. They may only eat one food one day and not the next. This is not what we're referring to when we talk about selective eating. Selective eating is typically an ongoing challenge with a limited food range. The good news is, no matter where you fall in that range of selective eating, we are hopeful that the strategies discussed today will be applicable to you. And here's a helpful resource from Holland Blue Review, which just depicts a little bit of the difference between what a child with ARFID may present with versus a child with what we call selective eating or picky eating. The primary differences being the food range, like we already talked about, as well as difficulty maintaining weight and nutrition. So we will be focusing today on strategies that would be more applicable to a child that fits within that picky eating category. When we're talking about feeding, it's really important to consider the oral motor skills and development of your child. So just like gross motor skills follow a developmental sequence, for example, learning to roll and then sit and then crawl and then walk, the mouth also follows a specific developmental sequence. Your mouth has to develop the right skills to manage the texture that you're offering your child. It's important to offer them the foods that match their developmental level rather than their chronological age. Managing more complex textures, for example, such as crunchy foods, require a much different muscle coordination and anatomy to manage food in the mouth and to swallow it versus a thick puree or a puree. And so if your child is logically age 4, but developmentally they might be closer to around a 1.5 to 2-year-old, then we really want to make sure we're feeding them based on their developmental age versus their chronological age. The next consideration when we're looking at things that can affect feeding are sensory. Here we have listed the 5 senses that we typically hear about. So sight, hearing, taste, touch, and smell. And there's 3 new ones that are added here that we often consider as occupational therapists, and that's movement, which you also might hear as proprioceptive input, balance, which another word is vestibular input, and interoception, which is understanding the feelings inside of your body. So the feeling of hunger or the feeling of having to use the washroom. We're going to talk a little bit more about sensory considerations later on in the PowerPoint, but just as an overview, it's really helpful to start thinking about your child's sensory profile and how it could relate to feeding. So what do you already know about your child's sensory profile? Do they avoid touching certain textures during play, such as water or sand? Do they seek out a lot of movement and heavy work, such as pushing, jumping, or climbing? Consider how that may play a role in mealtime and adapt as necessary. In the first example, you may be cooking fish for the family, even if you know you're not serving it to your child because you know they don't like it. However, because fish has a strong smell, it could cause discomfort for your child just being around it if they are quite sensitive to smells, something that we don't always consider. The theme of sensory considerations will come up again throughout this workshop in the form of environment and food. Temperament is a child's temperament describes the way they approach and react to their world. It is their personal style. It influences the child's behavior and how they interact with others. So when we're talking about temperament and how it relates to food, children who are generally, for example, on the more cautious side in day-to-day life may approach food similarly, cautiously. So it's really important to consider your child's temperament when you're thinking about how to help address selective eating. You know your child best, so it's really about what you think is going to work best for them. When we're talking about feeding challenges, we also want to consider any previous negative experiences that you or your child may have had with feeding that may be impacting their ability to progress their feeding or expand their feeding range. So some examples that we may not always think about that may impact our children longer term is near choking or choking incident, perceived pressure to eat foods, a feeling of nausea or illness related to eating or before eating, or having an uncomfortable sensory experience related to eating. So when we know, or if we can identify that there has been a previous negative experience, we want to really focus on rebuilding our child's trust with mealtime and build a positive relationship. A perfect example of having had a previous negative experience that unfortunately many of us have probably had is if you've ever had the stomach bug. And typically we might become a little bit averse to the food that you ate before you got sick. And that's a perfect example of how our previous experiences can shape how we approach food in the future. Just an extra note that if you do feel that anxiety or trauma have had a lasting impact in multiple areas of your child's life, it would be helpful to seek out support from an expert as well, rather than trying to manage it on your own. The last factor that we want to consider when we're talking about mealtime and feeding is environmental factors that may impact our child. So this could include the caregiver stress level, which many of us here can probably relate to. When your child is already having a difficult time eating, we do tend to get a little bit more stressed about getting enough food in them. Are they getting enough nutrition? The other environmental factor that we'll talk a lot about in the next presentation is mealtime routines and the environment. And then lastly, we'll also cover this in the next video, is positioning and physical supports. So to recap, in part 1 of Selective Eaters workshop, we have provided an overview of feeding, helped to define what a selective eater is, and provided a brief overview of factors that impact feeding. In part 2, the next video, we will touch on setting up a positive mealtime environment and the importance of a mealtime routine.